I'm Tamara Thomas, editor-in-chief of UrbanHealthToday.com, part of the DocWire family of medical news sites, and I want to thank you for tuning in to Urban Health Weekly. Our goal each week is to keep you informed of the latest in health and medical news right from today's headlines. It's time to empower yourself with open conversations about your medical care with news that matters to you. So are you ready? Let's get started. This is Urban Health Today, and I'm speaking with Henry McMillan, former head of atopic dermatitis marketing and specialty care at Sanofi. He's here to talk about engagement of dermatologists, allergists, and advanced practice providers in training regarding new treatment trends. Thanks for speaking with me today, Henry.
Tamara, it's my pleasure to be here with you today. Thanks.
It's a pleasure to have you here today. All right, let's begin. Please tell us about your background and your work while you were with Sanofi.
It's an excellent opportunity that I had with Sanofi. When I joined them, I was basically doing work as an individual contributor on a brand called Dupixent, which was indicated for atopic dermatitis. And at that time, the drug was looking to get an indication in the adolescent population, 12 to 17, then ultimately all the way down to 6 months. So I had a wonderful opportunity working on those projects individually as well as with team members, and then seeing the brand grow. My most recent position as head of atopic dermatitis marketing in the US really gave me a chance to look at strategy and really put an impact on the drug.
Could you discuss the specific challenges pharmaceutical companies face when trying to collaborate with medical schools to educate about new dermatology or allergy treatments?
Yeah, that's a really good question. One of the key issues in the marketplace right now is there has historically been a bit of distrust from the medical schools toward the pharmaceutical industry regarding influence, meaning that they thought that the industry was influencing the younger physicians in training in an inappropriate way. And therefore, they cut access, if you will, to those individuals in training from individuals like myself in the pharmaceutical industry. Obviously, we meet people at conferences, et cetera, but really having a stronger engagement with them in some instances was not allowed by certain medical schools. And it's unfortunate because we have seen as physicians get into their own private practices, they don't have the knowledge and experience with drugs such as biologics, which are really now making a huge difference in terms of patient care, particularly for atopic dermatitis.
Who gave you that feedback that they were worried about influencing younger MDs?
This is a long-standing issue, not just in terms of work that I did at Sanofi, but at other companies. There has been a lot of, if you will, challenges for industry working with students in training because the med schools had concern about the undue influence that the pharmaceutical industry could have. And what's unfortunate is there's a lot of educational effort that the pharmaceutical industry does provide in a very positive manner to support patient care. Because at the end of the day, it is really about improving patient care. And so I think personally that the challenges that have been put forth to the industry by medical schools really at this point is inappropriate because the challenges that they had initially, those issues have been resolved. I think now for everyone to work collaboratively is really more important. And there are clearly medical schools that do work with industry, but there is still a pervasive challenge by several medical schools in terms of training and working with their students in training with the industry.
So, given the prevalence of skin conditions like atopic dermatitis, from your perspective, what's your perception of the amount of time allocated in terms of medical training, learning about the condition?
It was amazing to me because the skin is the largest organ in the body.
Right.
Atopic dermatitis is one of the most prevalent conditions in dermatology as well as allergy. And so the training that people were receiving, that to my knowledge, is quite small. It's not a lot in terms of diagnosing and actually treating, managing patients. Typically your thought is keep the skin moisturized, put topicals on it, and there you go. Well, the condition is much more involved than that. When you look at cytokines that are involved in atopic dermatitis, we're talking about a major inflammatory opportunity of the body. And so it's really important that people are well trained to understand that it is definitely, a situation that goes skin deep. I mean, it is very involved in terms of the ability to look at how you can influence inflammation in the body, particularly in the skin.
What role can pharmaceutical companies play? You talked about, them having tools. What role can pharmaceutical companies play in enhancing the educational experience of medical students and APPs regarding these new treatments?
Yeah, with nurse practitioners and uh, physician assistants, which we now refer to as APP, there's a lot that can be done because their training is certainly not as involved in some cases as I think dermatology residents and fellows are. So it's really important that everyone who has the opportunity to treat patients has a ground, uh, if you will, a grounding in the understanding of the inflammatory process, particularly associated with atopic dermatitis. And the industry can play a very key role. We have studies that have been done, talk to people who are thought leaders around this particular condition, and certainly it's important to make sure that the science around treating is well disseminated so everyone has a ground understanding, if you will, of what's going on in this disease state, and particularly how to appropriate out, the different stages of the condition. There are chronic, sufferers, there are somewhat episodic sufferers, there are infants, fixing the drug that I had worked on previously down to the age of 6 months. There are other ages that are looking to try to get down to that age as well, because the condition often starts very close to birth. And so there's a lot of knowledge that has to be given to everyone who's involved in terms of making sure they're very well aware how early this condition can pop up and then what to do based on the patient's age and their severity of disease. The question was, what can industry do? I think a lot of it is making sure people are aware of the burden of the condition, aware of the opportunity to treat the condition appropriately, and then how to measure success over time.
I wonder, given the historical hesitancy of the industry, should pharmacy be involved in the training?
The biologics, because of the way they are delivered to the healthcare system, I'm not sure that pharmacists should be involved, but I do believe that industry should be very, very close to those in academic centers, because it's important for those that are being trained to go out and give patient care are fully knowledgeable of everything that's available to them, not just a little small segment of therapeutic options. And so the relationship between industry and those in training, and then those that are now in practice, is very important. And it's not just enough to say, well, we've given some information on a drug, therefore go use it. You have to really understand what the mechanism of actions are for the different agents so that you can apply those appropriately. You have to understand their risk benefit profile so that you have I would say, a very well educated opportunity to use them appropriately for appropriate patients. So there's a lot in that dialogue. Definitely takes place, one, at the level of field sales forces, but two, also at the level of engagement with specialists and, if you will, medical affairs, those scientific discussions that do take place that are appropriate, and then also the discussions between providers and commercial leaders, such as the role I had previously. And so it's really important to just keep that dialogue open. It doesn't mean that someone's going to use your drug because you're talking about it, but it does mean you have the chance to educate people about options. And that's really important.
So I'm just wondering, are you concerned at all that only the pharma companies who participate in the education, are you concerned that their products will dominate, or would that education be brand agnostic?
There is a place for, call it unbranded disease state awareness education. It is definitely important because it brings the true burden of the condition to those who are treated. There's also a need for, in my humble opinion, branded discussions so that you really do understand what is available, what are the pros and cons of a product that is being used in the condition. I think that there's always a healthy balance, being from the commercial side.
Mhm.
We like to think that, we develop material based on fair, balanced information and that it's disseminated in that appropriate manner. So we believe that we're providing a service from an educational standpoint, even though it's brand. I think that there is always going to be the need to have unbranded education. And as a leader, particularly in a marketplace, it is incumbent upon that company to provide that sort of unbranded educational information because you're really trying to move the treatment of the condition forward. It's also very important that all the companies provide really good information about their individual components so that people understand benefits and risk of perhaps using a certain medication.
You mentioned previously the variability of advanced practice provider training depending on their employers. Can you talk about some ways to standardize this training so that all of them have a consistent knowledge base about the newest treatments?
Sure. I was, I'll just be very honest, I was surprised when I started hearing about this variability of training. I'm thinking everyone goes through PA school, everyone goes practitioner training in a similar manner. When they come to dermatology, they
Mhm.
have a ground understanding. Well, first and foremost, sometimes someone will start in a primary care practice, then they will move to a dermatology practice. Don't know what they learned in the primary care practice, don't know if that derm that they're moving to has the time or capacity to train them appropriately. So there's a lot of variability. Now, how can you reduce that? There are certainly groups out there that are providing continuous medical education information for their specialty. So I do think that's important. And personally, when I had the opportunity to appropriately support that, uh, it's always good to do that because one, that's moving science and treatment forward. But there is certainly a lot of variability. I don't know that there are training programs that are specific for dermatologists for dermatology advanced practitioners that are moving forward. So I think as I saw this in the marketplace, I really understood that there is a need and there is an opportunity for industry to step in the gap a little bit and at least provide some foundational training that everyone could agree to and then have an expert in this particular area and expertise in being a nurse practitioner and treating patients in the dermatological conditions appropriately, being part of that training. So I do think that there's an opportunity, there's a growing opportunity because that is really growing in terms of the number of folks that are putting into the practice of treating dermatological conditions.
Are there any models or programs that pharmaceutical companies have successfully implemented to bridge the education gaps in dermatology and allergy training? And if they do exist, what makes them or made them effective?
You know, that's a little bit of a hard question for me to answer because I'm not clear what other companies were providing. I do know that companies provide support versus an actual platform program. I do know that there are organizations, professional organizations in those areas that try to provide training on a routine basis. And then there are dermatological um, conferences that they can go to as well. So I don't know if there's one company doing anything specifically in this area. What I do think, everyone is trying to one support, and there are a number of dermatological conferences, I should say, like, where education is provided. So I know a lot of the companies are supporting in that way, but to have a specific platform program, don't know that there is one at this point. As I said, those groups have their own medical societies, which also try to provide some training appropriately. So I can't say that there's a specific program that I am aware.
What about any education? Have you seen any education focused on skin of color? Because certain conditions obviously look different on skin of color than white skin.
Yeah, without a doubt, the Skin of Color Society certainly has provided a lot of education to practicing dermatologists. I mean, there's a clear recognition that this is an area that needs to be worked on. The reason that there is because one, all the pictures that people see, typically are of Caucasian patients, and conditions show up very differently in patients who have skin of color. You have Southeast Asians, you have Latinos, you have African Americans, and so these conditions do not look the same on everyone, and it's important because you're treating a visual condition to have pictures that are representative of condition based on patient populations. And so it's really important. And when you think about the folks that are treating patients, there's a growing number of dermatologists that are of color, which is a good thing. There are also a number of physicians who are dermatologists who are Caucasian, and they need to understand when they see those patient populations. So I think that there's a lot more that can be done, but there's a lot that's already been recognized as an opportunity in this area. And I believe and quite excited to see more growth in this particular segment.
And just to be clear, is this a partnership between pharma and companies like or organizations rather like Skin of Color? Or
They're
Skin
definitely,
of Color themselves going out and saying this needs to be done?
it's definitely a partnership. The major meeting in the U.S. and the international meeting is American um, Academy of Dermatology. A number of groups, including the Skin of Color, typically have meetings right before that session so that they can sit down and talk to their colleagues across the globe about these particular issues. And pharma actually does attend those meetings, does support those meetings as well. So it gives a person, if you will, an opportunity to really see how the field is moving forward in this particular. I think all the companies that are really engaged in dermatology do recognize this is an opportunity to partner inappropriately.
Looking forward, what strategies do you see or envision for improving engagement of healthcare professionals and training about new agents or treating atopic dermatitis?
Yeah, that's always it's a really good question. I know that in a former life, you know, I spent a lot of time thinking about how can we engage with fellows. There are certain groups that are part of commercial that actually have an outreach to medical students, and depending on the program, some of them will be supportive. I think the company has to come to those opportunities with a very clear, let's have a win-win partnership. You certainly want to help support your education, whether it involves our product or not. We also certainly want to inform you about our product so that you have the opportunity to perhaps use it while you're in residency practice, fellowship, and move toward a post fellowship scenario. They're aware of the drug. So I think that there are opportunities for pharma to really engage. There are programs designed for fellows at some of these major conferences where pharma has a chance to provide educational information, et cetera. So I think it's one understanding between medical school, what are the rules of engagement, what can be spoken to, what cannot be spoken to, are there opportunities to have folks invited to programs where there's branded information presented. So it just depends, I think, on how it's approached and making sure that at the end, everyone feels that it's done. It's a win-win for every party.
How did your company navigate any, or did they navigate any regulatory and ethical considerations when developing educational programs for training institutions and HCPs?
Sure. Every company has what's called a medical legal review, meaning that information that you're prepared to share has been reviewed for its medical content, make sure legally it's ethical and from a regulatory standpoint, it's consistent with the guidelines for promotional materials. So I think every organization clearly reviews their information in that way. So I don't want to specifically say one versus the other. Everyone has to abide by those FDA standards in terms of providing material and information to make sure it's fair and balanced in its presentation. And so you go in with the thought of how can we best educate people on the science, on the disease state, and then on the brand. And once you make that determination to the degree of what's most important in this particular presentation, then you move forward. So I think, it is appropriate. You just want to have a very clear, unbranded presentation about the disease. It's educational. And particularly at that point where people are in their training, that's probably useful. There's also the need to say, okay, now you're getting ready to see a patient. What are you going to use? How are you going to make the determination what's appropriate? And so having branded information, which I think appropriately and ethically presents your product to that audience, is also relevant.
Have you seen any movement in a positive direction regarding the historical hesitancy of institutions to training the medical students, MDs? Any improvement in that relationship?
I Yeah, I hate to say no, but it's been my experience recently. There's still a degree of two islands in that relationship. I think over time, my hope is that when we think about patient care and we understand innovation in science, there are ways to work together. There are boundaries that need to be set, but there definitely are ways to work together. And so I don't know that it has gotten better. I think more people who are engaged in, you know, the digital world, they see and learn things from that vantage point. And I think hopefully that engagement will subtly break some of the barriers that are there when people really get content and they want their teams to expose to that content, be exposed to that science. That is my hope. And I understand uh, a degree of the reluctance, but I think that everyone who was a bad actor, all that stuff is years behind us. I think now the relationship is an overhaul and reevaluation because, particularly in the United States, innovation is really, really key. And a lot of those innovative opportunities reside with pharma. And so to be able to partner with people on one hand for research, but then not be able to share information about the research and the impact on patients, it's somewhat counterintuitive. And so I think
Right.
everyone needs to really talk through what does an appropriate engagement.
It would be interesting what medical schools envision that relationship to look like going forward, because at the end of the day, I would think that the most important thing would be the patient and um, being able to provide the best patient experience and then being able to answer patient questions and being able to offer them the best treatments available for their conditions. I think. I don't know how you feel about that.
You know, I think COVID is a really, really good example. That was a crisis.
Mm-hmm.
And the pharmaceutical industry, I think to its credit, rose to the challenge of really finding ways to address this and then getting these vaccines in the hands of providers, in pharmacy, etc. I think if we take that model and look at, there was a sense of urgency, there was a degree of trust, there was a degree of informing people. Those things work extremely well. Now, if we go back and look at a day-to-day dynamic around treating something like atopic dermatitis, one, there's great science. Every company in this field is doing good work. They're doing great studies. They're showing based on what they need to show, based on the FDA's requirements, that their drugs are effective. Then to have a situation where now you have an effective agent out here, but you really don't have a chance to talk to those folks who are just about to enter the workforce because they're fellowship or they're about to enter fellowship, so they're going to be treating people in a confined environment. It's important that they know what's going on. And in some cases, because of the challenge in connecting with industry, some of their attendees have not used some of these drugs as well. And that to me is probably one of the more um, I would say disappointing situations because these drugs that are being produced now, these biologics particularly, really have made a big difference in the treatment of this condition. And the condition, and I think this is the bigger part of the situation, has so many legs. One, we think, oh, it's just a situation where your skin itches. Well, your skin itches, you can't concentrate, you can't sleep. There's why is my skin so affected? People, particularly, children, they don't understand that, this other child has a skin condition. It's not like they bathe or, clean themselves in a very effective manner. But, all these things happen. And that's why it's so important for people to really think about what are the agents that are safe, highly effective, and really can impact, you know, if you will, quality of life. Now, I'm not in a role at this point in time, but quality of life is a really important issue to discuss. I think really important for people to be honest about, how these agents really made a difference. And so I think it's a missed opportunity when there's such a gap in engagement between industry and those in training, because the people in training will be next 20 years. And so it's important that everyone be knowledgeable about new advances in treatment.
I've heard doctors say that what they prescribe comes down to oftentimes what the insurance will pay for. And so when you have patients with, say, Medicaid or Medicare, what happens then? So it sounds like that puts certain providers, not all providers, but certain providers in a bit of a care situation, right?
I
Because
mean,
ideally they'd like to give them the the biologics, but the economics are just not there.
yeah, the managed care environment is fraught with a number of challenges. I will say this, most companies have programs for people that fall below the poverty line that can assist. But even in that scenario, sometimes the copay is still out of reach. I don't know the answer to that one because it's frustrating to think that there's a good medication and people just can't afford it. Medication. And I know, having sat in the seat, uh, that all the companies really do try their very best. But I think physicians who see that their patient needs medication definitely have the opportunity to advocate for those patients. And that takes time. And that's frustrating for them. It's like, I just want to write the drug out and keep moving. And I get it.
Mm-hmm.
You're spending time with insurance companies on a prior authorization. It's not always the most, I'll just say, use of your time, but you have to come back and think about this patient. You now have the right to help this patient in a way that perhaps no one else will. And so you have to kind of advocate. And I think that Medicare situation, paid situation, every company has a obligation to do their very best. People who may not have the means or the insurance to support, like, yeah, no problem.
Mr. Henry McMillan, thanks so much for your time and your expertise. I really appreciate your insight into this topic of atopic dermatitis.
Thank you so much for giving me the time and the opportunity to share my thoughts with you. It's been a pleasure. Thank you.
Thanks for listening to Urban Health Weekly today. I hope you'll join me and my friends next week so you can stay informed and inspired to take control of your health. See you next time.